हेलो एवरीवन। हम लोग साइकोलॉजी के क्वेश्चन आंसर देख रहे हैं। क्लास 12 की साइकोलॉजी है। इस वीडियो में हम क्वेश्चन देखेंगे। एक्सप्लेन विद द हेल्प ऑफ एन एग्जाम्पल हाउ कॉग्निटिव डिस्टॉर्शंस टेक प्लेस। आंसर: एरॉन बेक devised cognitive therapy. It is also known as cognitive restructuring therapy. Basic assumption: negative thinking, irrational beliefs, and faulty generalization caused disorder. This therapy believes that repeated cognitive distortion play significant role in causing disorder. Cognitive distortion means way of thinking which are general in nature but which distorts the reality in a negative manner. Example: persistence, negative and irrational thoughts such as nobody loves me, I am ugly, I am stupid, etc. Step 1: analysis of core schemata. Childhood experiences provided by the family and society develop core schemata or systems which includes beliefs and action patterns of the individual. A client who was neglected by the parents as a child developed the core schema of I am not wanted. This may be validated by the teachers in the school. Such negative automatic thoughts cause cognitive distortions. Cognitive distortions are ways of thinking which are general in nature but which distort the reality in a negative manner. These patterns are called dysfunctional cognitive structure. Repeated occurrence of these distorted thoughts leads to the development of feeling of anxiety and depression. Treatment method: the therapist use questioning which is gentle, non-threatening and non-judgmental, non-probing but thought-provoking questions. The questions make the client to think deeper into his assumptions about his life and problems. These questions make the client to think in a direction opposite to his negative thoughts and gains insight of his dysfunctional schemas and able to restructure his thoughts in positive direction. Beck's Beck's cognitive approach does not attempt to disprove the ideas held by the depressed person. Rather, the therapist and clients work together to identify the individual's assumptions, beliefs, and expectations and to formulate ways of testing them. Aim of the therapy: cognitive restructuring by helping people to, to recognize and reject the false assumptions that are central to their difficulties. Which therapy encourages the client to seek personal growth and actualize their potential. Write about the therapies which are based on this principle. The humanistic existential therapies encourage personal growth and actualize the potential. Fundamental assumption: the client has the freedom and responsibility to control his or her own behavior. Psychological distress arises from feeling of loneliness, alienation, and an inability to find meaning and genuine fulfillment in life. And individuals have desire for personal growth and self actualization and an innate need to grow emotionally. Causes of distress: obstacles created by society and family to achieve personal growth, obstacles in attainment of self actualization because it requires free emotional expressions. Treatment modalities: the therapist is merely facilitator and guide. It is the client who is responsible for success of the therapy. The client initiates the process of self growth through which healing takes place. Therapy is based on humanistic existential approach. Logotherapy is a form of existential therapy. Viktor Frankl. is a psychiatrist and neurologist propounded logotherapy. Basic assumptions. Logo is the Greek word for soul, and logotherapy means treatment of the soul. Person's desire of finding the spiritual truth of one's existence is the source of motivation. Binding meaning of self even in life threatening circumstances is a process of meaning making. There is a spiritual conscious which is the storehouse of love, aesthetic awareness, and value of life. Aim of the therapy to help the client to find meaning and responsibility in their life, irrespective of their life circumstances. Treatment modality the therapist emphasizes the unique nature of the patient life and encourages them to find meaning in their life. The therapist is often and share his or feelings, values, and his or own existence with the client. The emphasis is on here and now. In the therapy, transference is actively discouraged. The goal is it to facilitate the client to find meaning of his her being. Gestalt therapy. It is humanistic therapy developed in Fritz Perl and his wife Lamia Pearl. It helps the client to develop self awareness and self acceptance. The client is taught to bring his disordered thoughts, conflicts, and anxieties to his awareness. The therapist does by this encouraging the client to act out of or speak out his her fantasizes about feelings and conflicts. This therapy can also be used in group setting, client centered therapy. This kind of therapy is developed by Carl Rogers. It is based on the non-directive approach. To understand individual, we must look at the way they experience events rather than at the events themselves. The therapy provides a warm relationship in which the client can reconnect with his or disintegrated feeling. The therapist shows empathy, that is, understanding the client's experience as if it were his her own, is warm and unconditionally positive regard, that is total acceptance. The therapist reflects the feeling of the clients in a non-judgmental manner. The reflection is achieved by rephrasing the statement of the client, that is seeking simple determination clarifications to enhance the meaning of the client's statement. According to this therapy, personal relationship improve with an increase in adjustment. In essence, this therapy helps the client to become his or real self with the therapist working as a facilitator. What are the factors that contribute to healing in psychotherapy? Enumerate some of the alternative therapies. There are several factors which contribute to the healing process. Some of these factors are as follows: the techniques adopted by the therapist and the implementations of the same with the client, the quality of therapeutic alliance, the regular availability of the therapist, and the warmth and empathy provided by the therapist has its importance. The quality of emotional unburdening catharsis has significant impact on healing. Non-specific factors are associated with psychotherapy. These are patient variable and therapist variable. Patient variable refers to attributed to the client. Example: clients moving for change and expectation of improvement due to the treatment, etc. Therapist variables refers to his her good mental health, absence of his her unresolved emotional conflict, and expertise. Alternative therapies are so called because they are alternative treatment possibilities to the conventional drug treatment or psychotherapy. There are Many alternative therapies such as yoga, meditation, herbal remedies, and so on. Yoga is an ancient Indian technique detailed in Ashtanga Yoga of Patanjali Yoga Sutra. Yoga, as it is commonly called today, either refers to only the asanas or body positive component, or to breathing practices or pranayama, or to a combination of the two. Meditation refers to the practice of focusing attention on breath, or an object or thought or a mantra. Vipassana meditation, also known as mindfulness based meditation, has no fixed object or thought to hold the attention. These persons possibly observe the various bodily sensations and thoughts that are passing through his awareness. The rapid breathing, the technique to induce hyperventilation, sorry, hyperventilations, as in Sudrasana Kriya Yoga SKY, is found to be a beneficial, low risk, low cost adjunct to the treatment of stress, anxiety, post traumatic stress disorder, depression, stress related medical illness, substance abuse, and rehabilitations of criminal offenders. Kundalini yoga taught in USA has found to be effective in treating mental disorder, obsessive compulsive disorder. It combines pranayama or breathing with chanting of mantras. Thank you.